Martins.
Gentlemen, I give you Evelyn Castle.
Thank you so much for having me, Reese. So, and then during Ebola, we were in the Ebola countries as well. That was a really cool chapter of the eHealth Africa career too. Was the Ebola time.
I mean, I can tell how passionate you are about this. I mean, you're the first person I've ever seen involved or describe anything that has to do with Ebola as cool. That is amazing. You're one of those, you run into the firefight.
But the goal really here is that, we know that when you invest in women and women get access to financing, that they invest that money in their children's health care, that they invest it in education, they invest it in their communities. And so, if we want to look at actually having like a sustainable generational impact in Africa, supporting women to get more access to financing, I think is really, the way to go. So Eha Impact Ventures is looking to support female founders and female-led startups so that they can be successful, and hopefully that money will then trickle down throughout their communities.
Martins.
Ladies and gentlemen, welcome to season 2, my very first episode of Chapters. And today I have a special guest in the building on Zoom virtually, one way or the other. There is a special guest right in front of me, a pioneering health executive and impact investor. After spending a decade working in health sector in Africa, she's now committed to building Africa's impact investing ecosystem with the specific goal of supporting female-owned small and medium-sized enterprises. Ladies and gentlemen, I give you Evelyn Castle.
Thank you so much for having me.
Oh no, this is pleasure is all mine. Pleasure is all mine. So on Chapters, I always start with a very simple question. And if your life is a chapter, if your life is a book, what chapter would you say you're on?
I would say I'm on chapter 5, in the middle of my book. I would say, I guess.
Chapter 5 surely cannot be the middle, because you probably have loads of chapters to give. Chapter 5 is probably still in the beginning.
Hopefully, I guess.
It's all good. With all the wonderful work that you're doing and everything that you're helping with the health services, it's definitely more chapters to come. But before we actually talk about everything that you're doing today and all the wonderful things you're doing for Africa, in Nigeria, let us go back to chapter 1. Where does life begin for Evelyn Castle? How did it all begin? Where were you born? Where did you grow up? And initially, how did you get to thinking, this is what I want to do? So let's go back. Let's go way back. So obviously, you're an American native. Whereabouts in America are you from?
I'm from Orange County, California.
That place has a lot of good wine, right?
California does in general, yeah.
Nice. My geography of America is terrible, but hopefully I'm learning as we go on. So born and bred in California, yes?
Yep.
Okay, and what was life like growing up? What did you do? What were you not doing? Where did you grow up with a family, siblings?
Grew up in a family, so I have one older sister. My parents ran a computer company when I was a kid, which was a pretty cool thing. So I was one of the few kids that had my own computer in my room back in the day.
Oh, that's cool. Everybody wanted to come to your house then.
Exactly. Although there was no internet really, so even though I had a computer, it was you could just use Microsoft Word on it. It wasn't that fun.
No, don't worry. Everybody was wowed by that big desktop everybody had in their house, whether it could do anything or not. And when the screen goes black and they see the cursor just flashing, people just go, "Wow, this is wonderful." So you were that kid. You were that cool kid that had the computers.
That was me. Yep.
Okay, and cool. And so, what did you study? What was life like in California? Right? Apart from your sister, what were the things that you used to do? What did you used to get into? Or the troubles that you caused?
So California is pretty big. So I grew up in Southern California in Orange County, which is a pretty conservative Republican part of the country, which I would say is not really my values or my family's values. It's like LA, so it's very superficial. It's always about who's wearing what, who's driving what Ferrari, who has the fancy house, that kind of thing.
You had the fancy computer, so you were probably in that line at some point.
That's true.
I take it you didn't have the Ferrari then.
We did not have a Ferrari. No, we were not that family.
Okay, cool. So then you did all that. You went to high school. Where did you study university, and what did you study?
So I went to University of California in Santa Cruz, which is like a 7-hour drive north of where I grew up. So again, just like California is pretty big. I studied biology. I wanted to be a doctor when I was going to university.
Okay, and what you wanted to, so what happened? What happened to that dream?
I came to Nigeria and then dropped out of college.
So you moved to Nigeria when you were 17?
No. I went to university first, and then I moved to Nigeria when I was 20.
Moved to Nigeria when you were 20, and then so that moving to Nigeria pretty much killed your dream of being a doctor, or you just decided I don't want to be a doctor anymore?
My dream changed. I no longer want to be a doctor.
So Nigeria pretty much contributed to your dream. And I mean, I am assuming you're living your dream today. So what was it like? So you moved to Nigeria, and how slowly did that dream of being a doctor just be removed from your mindset? And how did the dream start forming to what it is today?
So I realized very quickly that I don't think that I have the stomach to be a doctor. So I was working in a primary care clinic in Kaduna State in the north. And I was like working in like the labor and delivery ward. And yeah, I learned very quickly I just did not have the stomach to be a doctor. But while I was doing that, I was doing a lot of like this, like, you know, e-health and like m-health work at that same facility. And I found out that I loved that. And so it kind of coincided very well with the dream of being a doctor dying and realizing public health was more what I was interested in.
So would you say, so when you say you didn't have the stomach to be a doctor, yeah, I always find that very, very interesting. So did you see blood and just go, oh my God, no? Or did you just see yourself not being able to cope with the demands of being a doctor, or you felt you could help health in a different way other than being a doctor, the traditional doctor? And before you answer that, so you moved to Nigeria when you were 20. How many years ago was this? They say don't ask a lady her age, so I can just try and calculate it one way or the other.
So this was 12 years ago.
Okay.
So I'm fine to say I'm 32. I have no issue with my age. I'm very happily in my early 30s.
Oh, that's good. That's good. No. I mean, age is just a number, as they say.
Exactly.
Well, at least till you try and run a marathon or something, but age is just a number. Cool. So 12 years ago, and then slowly, you decided being a doctor is not for me. What were the key factors you recognized? I mean, I know you say you didn't have the stomach for it, but what exactly did you actually realize this is not for me?
So I think, I mean, like, yes, there was the kind of like the blood and guts thing ended up making me a little bit more nauseous than I had anticipated it making me. But honestly, I think like even it was more the fact that I just fell in love with public health and the idea of starting my own company. You know, my parents were entrepreneurs, so that's always kind of been something that I've been interested in. And so yeah, I mean, if I had never gone to Nigeria, I would probably be a doctor today. But I'm glad that Nigeria ended up changing this course.
So you moved on what was the key reason going to Nigeria? What exactly took you to Nigeria? Because were you actually going there to chase being a doctor, or you just wanted to travel the world and see what was happening? So what drew you to Nigeria specifically?
So I got an internship while I was in the university to basically like study technology and healthcare as part of like a program that I was part of. So I got the opportunity and I jumped on it to go to Nigeria.
Okay, and so you pretty much moved. So you went to Nigeria and you moved to the north, straight up to the north. Okay, that is amazing. And I mean, so you moved there, and of course you started your eHealth Africa business. What? Not long after you got there, is this when you did? So you moved there, threw away the dream of being a doctor, decided to draw the business-like mind of your parents, and decided to go into public health. And of course, blood and guts was not for you. So you started your company eHealth. So what is eHealth, and what exactly does eHealth Africa do?
Yeah, so eHealth Africa, we're a nonprofit organization, and basically what we do is like we look at using like technology and data to help public health workers make better decisions for healthcare. And so, you know, to kind of give like a little bit more context than just like our mission statement, one of like the big projects that we worked on in the beginning was the eradication of polio across Nigeria and across Africa. So one of the biggest issues with polio is that you have to vaccinate every single child. But, you know, the only way that you're going to do that in a country like Nigeria is through accessing data. So like, where are those children? Where are the vaccinators going? How many times have the vaccinators, you know, seen those children? So without access to all of that data and, operation planning supports, you can't kind of make these big improvements to healthcare or to public health without that.
So how long after did your business start when you got to Nigeria? How long did that take you? Because I mean, I understand as a Nigerian myself, I understand the wonderful sweetness of opening stuff in that beautiful country of ours. But how long did it take you to actually go into the business, create it, and start pushing out the information that you needed, and of course to start tackling polio and other diseases that were in Africa?
So my business partner and I decided we were going to give it 6 months. So it was just the two of us, and we obviously, just cashed out our savings and moved to Nigeria. So we gave it 6 months, and we were like, we'll reassess where we are in 6 months, and then take it from there. And my idea was I was originally going to go back to college, but that obviously didn't happen. But we made it like 5.5 months, and then on like that 5.5 months, we got our first contract, and we were like, we've made it. We're like, this is it. Like and we never looked back after that.
So who did you actually know? Did you actually have like a network in Nigeria? Did you have friends who got you into the groove of things? Because obviously, as they say, man no man and all that story that happens. But you cashed out your savings. Your savings must have been wonderful as a 20-year-old. You cashed out your savings and you were able to hold a business for almost 6 months. So did you actually have a network of friends? Did you have people that helped you implement the business? How did the word spread?
Yeah, well, so I will say we got some, we raised some money before we left because I was 20, I didn't have any money. So I think we raised about like $15,000 from people in the US who liked our idea. And that kind of got us at least started. But yeah, we had a lot of, so we knew some connections to the university. There was a woman doctor who let us stay at her house for 3 months, obviously for free. We had friends in Kano who gave us free office space, and we're just like really, the nice thing about the North is that they are like really community focused. So there were a lot of people up there who were really interested in helping us. Like they would, like one of our friends, one time saw me on like a motorbike, and they were just like, what are you doing? Like, here's my car. If you need to go somewhere, like you can borrow my car. So people were really helpful for us when we were getting started.
Okay, so one of the first questions I'm going to ask you is, so obviously, you know how Nigeria is they dwell into religion and different cultures and all that story. How has your idea in terms of how's it been tackling some of this old traditional values and getting people to understand what you're actually trying to do and helping them with health? And of course, have you actually found any difficulties being a woman up north in Nigeria? How's that played out in your amount of years that you've been there?
It's a big question.
I know.
I think, the culture obviously causes challenges, and I wouldn't necessarily say a lot of it is just like religion. I think a lot of it is more like culture. So we do a lot of work on like women empowerment, and one of the goals that we have as an NGO is to have gender parity just within our staff. But when you can only hire male drivers, when males are the only ones that are able to go out and do field work, because women, it's frowned upon if women are going out and doing field work. Males are the ones generally who are
the dominant gender, as they say.
Exactly. Yeah, it's hard to find. We put a priority to find women to come into our company, but it is hard to find women in the North who are as qualified as men and who are willing. And it's not even so much as qualified. They are just as qualified. It's just that they don't have always like as much freedom as their male counterparts would have, which is, because they have families at home, they have to go home and cook dinner, they have to take care of the kids. And, it's frustrating to fight against that cultural stigma, whereas, they're probably making more than their husbands are, but yet they still have to play all of these cultural roles as well.
Okay, so one way or the other, you've created a system that has allowed women to empower women to help you, and they have, of course, helped the business, EHA. and of course still maintain that cultural and religious background at the same time. I know, I mean, it's a proper, I'm sure it's an everyday situation that's improving, but you're managing to find out as you're going. So
Mhm.
are you predominantly up north of Nigeria? Have you spread the EHA to the other sides of the country, and of course the other sides of Africa?
So the majority of our work is still kind of in the north because that's where a lot of the public, like the major public health issues are, like where we see still some of the polio outbreaks, the cholera outbreaks, things like that. But we do, we have an office here in Abuja where I am right now. And then we do have a really cool project that we're doing across Africa right now, supporting the polio outbreaks across different West Africa or across different African countries. So, and then during Ebola, we were in the Ebola countries as well. That was a really cool chapter of the eHealth Africa career too. Was the Ebola time.
I mean, I can tell how passionate you are about this. I mean, you're the first person I've ever seen involve or describe anything that has to do with Ebola as cool. That is amazing. You probably get one of those, you run into the firefight. That's good. I mean, you pretty much had a very wonderful, interesting 10 years or 12 years since you touched the shore of Nigeria. So in 2018, you entered the private healthcare industry, co-founded EHA Clinics, a network of primary health care providers with the goal to become the premier healthcare provider in Nigeria. So, how is that goal going? And would you say you're the premier healthcare provider right now, as it stands?
So the goal is going very well. For a small startup, I think that we've made some major progress. And I would say that like where we are in the quality of the care that we provide, I honestly don't think that any other company in Nigeria can say that they're better than us. I think the major issue that we have right now is that our scale is quite low or is small because obviously it takes capital to expand our network. And so right now we only have clinics in Abuja and in Kano. And really our goal would be to have like a network in kind of all of the major cities. So because we know Nigerians are very transient. I mean, like because of business, one day you're going to be in Lagos and the next day you're in Enugu, then you're in Abuja. And, if you fall sick, you need to have a clinic that you rely on, that you know the name, they know who you are, that you can go to and access quality care. And that's really what our goal is to be.
Okay, so what are the major challenges that you have actually? So when you think about it, and because I mean, as I said, you describe Ebola or tackling Ebola as cool. So you're clearly a very strong woman. Um, I mean, and I say this in the utmost respect and very good. You seem very stubborn, driven with your goal. One of those, I'm not going to take no for an answer. What have been the trying points for you in this wonderful time in terms of because you're pushing forward to do things that people haven't done before, especially in a you know third world country where a lot of perspectives are very different, culture, tradition. What are the things that you're still battling today that is actually difficult, and what is the thing that is away from business and medicine that actually gets to you that you're still trying to implement?
Mm-hmm. So I think like the biggest challenges that we have right now is one on just like talent. We know that like there's not enough medical schools in Nigeria just to grow the number of like doctors and staff and nurses that we need in the country. And then it doesn't help that Canada right now is like poaching all of our staff, like all of our qualified medical personnel. Like every day they're coming to me saying that they got a visa to Canada. And so it's like, sorry, I'm not like anti-Canada, but
You sure?
yeah. It's a great opportunity for them though. I mean, they should go. I can't fault them for doing that. But, if we're talking about providing quality care and expanding, it's going to be really difficult to do that if we don't have staff in the country who can, be with us.
So what can you do to keep the staff? So obviously you're giving them an opportunity for them to help grow, creating a startup, an NGO, and different ventures that can actually help improve certain things in the country. And I know we have security and projects, infrastructure. It's difficult, but what would actually make the reason I asked this is so you left the Ferrari computer, Top Boy, California, as I said, wine, all the wonderful things, and you decided to start a dream by kicking another dream away, and you are still going strong regardless of all the troubles you have. So, how would you convince somebody else to stay and help you with your goal, especially with things being how they are, and of course, oh Canada coming
Mhm.
in to poach your stuff?
That is the $1 million question. And, I think it's the question that probably every industry is asking themselves right now, because, we have like a worker shortage, in a lot of developed countries. Like the US right now has a huge worker shortage as well. And when you look at it, like especially Nigeria, we have incredibly intelligent, incredibly well educated, incredibly skilled people that are offered a better life, in another country. And of course they're going to take it. It doesn't, and it doesn't even matter how much money. Well, one is there's no way that I can offer the same salary, because the market in Nigeria just isn't there to be able to compete with, to be able to offer those types of salaries. But even like if you look at like the technology side, from the NGO, a lot of our work and staff are technology, like software developers or GIS analysts. They're all going to Berlin right now. So it's not even just like the medical workers, and it's not just the health industry. Across the board, the brain drain in Africa is massive, and it's difficult because there's no way that Africa is going to really be able to succeed with everybody leaving. I will add the caveat though, that like the reason why I came to Nigeria was because there's way more opportunity here than in America. And I think that what you're seeing now, like in Lagos with like Flutterwave, with the pay stacks, like these types of groups, there is a lot of money to be had in Africa if you play your cards right. But that's more from like the entrepreneur side, I think, than the software developers or the healthcare worker side.
Okay, so you just said there's way more opportunity. Are you talking about in terms of a business entrepreneur, or you're talking about in terms of the medical flow of things?
Like the business entrepreneur. So if you have an idea and if you can make it work, you can make way more money here, basically. Like, but the risk, it's higher risk, higher reward.
Okay, so the 20-year-old girl that had no money is actually a 32-year-old woman now that would possibly say she has way more savings than she had back then, and that's because
way more.
Way more. Okay, that is good. That's good. So would you call Nigeria home? Is Nigeria your home? Is it, because I noticed that you were describing a lot of things and you said we, which is very nice. Obviously, I mean, you're American. There's no change in that. I remember when I got in contact with you and I thought you were British, and you can always tell when an American tells you, no, I'm American. You can feel the harsh words like, hey, listen, I'm American. But would you say Nigeria is home at the moment?
I would. I mean, I'm very much American, but I would say, but Nigeria is home for me.
Okay, well, home is where the heart is, as they say. So there's no arguing that. So you're the co-founder of three ventures. So eHealth Africa, eHealth Clinics, and Eha Impact Ventures. So now, and did you co-find all ventures with Adam Thompson, who happens to be your business partner? Or are you in partnership with other people?
So all of those three were just Adam and I. So Adam and I met actually at university in Santa Cruz together, and fortunately have a beautiful friendship and a wonderful business relationship. And so, yeah, we've done all three of those together.
Okay, so do these ventures exist or coexist or depend on each other to actually exist? Are they independent ventures, or do they all come together as one to actually form eHealth Africa?
So they're all independent ventures, but I would say that like all of them were built in a way because of a need that we saw in different areas. So, we started eHealth Africa, and then, which was really focused on providing public health. We weren't doing like actual medical delivery, but our staff didn't have access to quality medical care. And we actually had a couple different staff who ended up passing away for what we felt were really ridiculous reasons, just because they didn't have access to quality care. So because of that, we saw this huge gap. And so we said, okay, we're going to start EHA clinics. And we did that. And then earlier this year, we ended up starting Eha Impact Ventures. And this is now also a separate organization. It's still this is also a nonprofit organization. But the goal really here is that, we know that when you invest in women and women get access to financing, that they invest that money in their children's healthcare, that they invest it in education, they invest it in their communities. And so, if we want to look at actually having like a sustainable generational impact in Africa, supporting women to get more access to financing, I think is really, the way to go. So Eha Impact Ventures is looking to support female founders and female-led startups so that they can be successful, and hopefully that money will then like trickle down throughout their communities.
Okay, so that's good. So would you say, I know you want to empower women, and make things fair for women. No, I wouldn't say equal. Fair for women. There's no such thing as equality, at least in my books. But that's a different argument. But if we're making it fair for women, and trying to make sure that the business spreads and things are good. So, do you have a situation where, as a guy, if I had a small business and I came to you to ask for help, would you help? Or would you just turn me down and say, well, because I'm not a woman?
I would point you in the direction of all of the other funding opportunities that you as a man have access to. I would connect you, I would recommend you, and I would send you to those people.
What if it's a good opportunity that will probably help eHealth Africa?
It depends. I mean, so the reason why we say female-led is because we do want to keep the door open slightly for some of these like, extraordinary cases. So if there was like a partnership between a man and a woman, and they had a startup, and that startup was something that was really, great, then that definitely we could still continue to support. Or if like the startup, all of the women were beneficiaries, and so it still was like a very women-centric business model, that's something that we would consider as well. But, I do want to highlight, like I know that there's not enough opportunity, but there's definitely way more opportunity for male entrepreneurs out there. And so what we're trying to do, and we're not a big fund, there's these groups with like millions of dollars. That's not us. We're a small fund. And so we want to make sure that we're utilizing those funds for the people who really don't have access to that money.
Okay. So you seem like a fun person. You seem like at the same time, you seem like you work, and all that. So, but the question is very simple. When you're not, empowering women, fighting Ebola, and, helping people become healthy, what does Evelyn Castle do? What do you do that is not business like and is just you as a person? And of course, I mean, you're still achieving your goals, you're impacting businesses, you're doing a lot of things. But what do you do what would you call it, your downtime?
So I feel like this is like a really bougie thing to say, but a friend of mine gifted me their horse when they left Nigeria. So for the past few years, I've been learning how to ride a horse and how to train a horse, and that's been a really fun, a really fun experience.
Well, it's not that bougie unless your horse does. What's that thing they do in the Olympics? The horse dancing thing.
Yeah, mine does not do that.
You could be the first person to bring Afro beats into that. Just make your horse dance with Davido or something, and that everybody would just love it. But that is good. That's a good pastime. So which is pretty much an exercise. I know that story, but it's good. So I mean, most people wouldn't know what they want to do when they're 20. You found that out as soon as possible, and you actually ditched a dream to fulfill another, which has been good. It's been 12 years of good success and all that story. How often do you visit California and your parents and everybody else, or how often do they visit you?
So I normally go back to California like once a year, maybe once or twice a year maximum. And it's just because like it's a really long flight, and like the time zone difference is like really painful to go back that often. But I do try to like fly out my parents, not to Nigeria, but like to go someplace else. So like my mom and I went to Uganda earlier this year. My dad and I went to Spain a couple years ago. So, you know, I don't always want to just go home. It's kind of nice to like fly them out and meet me someplace for holiday.
Okay. Well, clearly from everything you have described now, you have actually described a lot of people's dreams. This business that started when you were 20 or 32 is going really well, going really strong. And it looks like there are more ventures to come out, empowering women, making sure that female-led businesses are wonderful. And at the same time, you know, providing data and doing everything that you do for public health. We applaud you, ma'am. We applaud you, ma'am. Thank you very much. It's a good thing that your dream actually was realized in a country like Nigeria that needs all this help. Um, One of the last questions I will ask you is, with all the issues and troubles that's been happening in the north for the last couple of years, has your business handled itself, and have you handled yourself? Have you kept yourself safe? Do you karate, ninjutsu? What do you do? Or your horse just rides really fast?
That would be a good, I'll talk to my security consultant and say if he can train us all in jujitsu.
There
That
you
would
go.
be
There you go. There you go.
But you know, it's really unfortunate because I think like it's not really. I know. I'm guessing you're from the south of Lagos.
I'm born and bred Port Harcourt, but I'm actually from Cross River State, Calabar.
Okay, but still, like all of you, like Southern Nigerians, always look at the north, and you're like, oh, it's crazy up in the north. You know, it's so insecure. But now it's like it's everywhere. Like the security challenges are everywhere in Nigeria. I mean, like you know, if you go to Port Harcourt, you can get kidnapped. If you go to wherever.
I'll be fine in Port Harcourt. I'll be fine.
Okay, well, you will be fine, but we will not be fine. But no, I mean, I would say out of everything, that's probably been the most disheartening thing of working in Nigeria over the last 12 years is that the security situation just like every year is getting worse and worse and worse. And you know, and it makes it way more challenging for anybody that wants to come in to do any kind of work because it's way more expensive because, you know, I used to ride around on Okadas. I can't do that anymore. You know, I never had to pay for a security consultant. I mean, we don't have like full-time like bodyguards or anything like that's, you know, over the top. But, you know, now we do have to pay for a security consultant to tell us, you know, where's safe and, you know, how to go places safely. So yeah, the security situation has been probably the biggest challenge for us and also just kind of like demoralizing in a lot of ways.
Well, hopefully you have been secured properly, which I think you have been, which is really good. Big shout out to whoever your security consultant is. And hopefully no much trouble, you know, be up there up north. Yeah, right. You know, I've actually never been up north. Well, I've been to Abuja, but I've never actually.
Abuja is not the north.
I know. It's the closest I've been to. It's the closest I've been up north. It's the closest, and of course, as you say, those of us from the southern part of Nigeria, we just like where we are. We're just happy there. I mean, I don't live there anymore, but that's the story. So we applaud you for all the work that you're doing. Thank you very much. Yes, as I said, so chapters actually explores the process of how you got to where you're going now. You say you're in chapter 5. What are the next couple of chapters, and what are we to expect? Because at some point, I would hope that you come back in chapters and tell us how, I don't know, you've probably be the first female white president of Nigeria or somebody. I don't know. I mean,
oh God, no! Please, God, no!
What is in store for Evelyn Castle and all your ventures?
So I'm just starting this chapter with the Eha Impact Ventures. We founded it earlier this year. We haven't actually, you know, we haven't made any actual investments yet. But I'm super excited to start this chapter. This is, you know, what's next for me. And yeah, honestly, that's as far. I think with like COVID now, I used to plan in like years, but now because of COVID, I plan in like months. So for the next like 6 months, that's my plan is really to just focus on Eha Impact Ventures and get that up and running.
Well, the key thing here is that there is a plan, even if it's just 6 months, and then hopefully you, with more 6 months and 6 months and 6 months to come, before you know it, you'll be 42, and you
retired.
If that's the plan, that would be wonderful. You'll be retired and probably have 3 horses this time instead of 2. So you never know. Evelyn Castle, it's been a pleasure. Thank you very much for having me, and thank you for coming on Chapters. On Chapters here, once you speak to me, we are friends for life. So if I'm ever up north in Nigeria, just speak to your security consultant to tell me where I need to be. You know, us from the southern part, we're very delicate when we come up north. And it'll be good to see you in person at some point. But thank you very much, and hopefully hear from you soon. Ladies and gentlemen, I give to you Evelyn Castle.
Thank you.
Uh-huh.